Hello and welcome to this training video on treating tension headaches and sinus drainage with massage. I'm Maureen Abson. I run and I'm the senior teacher for massage training here in the UK, where I also run a busy practice. Tension headaches are one of the most common types of headache. They're experienced by most people during their lives and they're the everyday headaches. Tension headaches used to be referred to as muscle contraction headaches or stress headaches, but that terminology has generally gone out of usage, but you might find some people who still use those expressions. Here in the UK, the NHS estimate that about half of adults experience tension type headaches once or twice a month, with 1 in 3 sufferers getting up to 15 times a month. In the US, 80% of the adult population will experience some kind of tension headache. Chronic daily tension headaches occur in about 3% of the US population, with women being twice as more likely to suffer than men. Tension headaches are known as primary headaches. That means there's no underlying cause about them. There's nothing to worry about. It's just an everyday headache. A tension headache can feel like a tight band around the head or sometimes like a weight on top of the head. The tension can be one-sided, but more commonly it's on both sides of the head. The tension can spread down the neck and shoulders or feel like it's coming up from the neck and shoulders. There's often a pain of sensation of pressure behind the eye. A tension type headache can last anything from 30 minutes to 7 days, but most will just last a few hours. Muscle tension in the face, the neck and the shoulders can cause tension headaches. Spending all day squinting at a computer or frowning will make the muscles around the forehead tense, and someone might do this for many hours at a time if they're working on a particular project. That can result in a tension headache. We'll look at this in more detail soon. Let's look at the anatomy, physiology and pathology of tension headaches. Take a moment now just to look at the diagram in your notes. It takes 11 different muscles to frown. That's 11 muscles under pressure. If that occurs for a long time, the tension has to go somewhere. We have some tasks for you to do in this course. The first task, spend 10 minutes with your notes using the diagram that shows you the 11 different frown muscles. Note the names of the muscles and their functions as they're listed in your course notes. Now take a mirror, maybe somewhere quiet where nobody's going to look or nobody's going to film you for social media, and try and isolate each muscle and its function with your own face. It might seem odd and you will pull some strange faces, but doing this will give you a really strong understanding of what each muscle does, how it works, and the energy it takes to use it. So take a mirror, try and isolate and tighten each muscle in turn and note its function with your own face. Now, having pulled a few faces, let's take a few minutes to revise our knowledge of the musculature and the connective tissue structure of the head, the neck and the shoulders. This is task 2, again, some self-analysis. Having poor posture as we work or we read, how we hold our phones with our heads down, we might be off to the side, it adds an incredible pressure onto our neck and shoulders. Have a look at the image in your notes and try to be aware of how you hold your own phone and how your posture is when you're doing that. You could be adding up to 60 pounds of extra pressure onto your spine just through your posture. And the surrounding musculature too will take quite a hit with that. That extra pressure could be the same as 48 basketballs, 4 or 5 bowling balls. That's what 60 pounds adds up to. So take a few minutes now to analyse your own posture. Maybe those of your friends and family too, if they'll let you. If you can't do it yourself, get someone to take a photograph of you just over the next few days as you're working, as you're sitting watching telly, as you sit and reading, so that you can be really aware of your own posture. Now to the final task, and it's a simple one. The connection between the head, the neck and the shoulders are complex. Just take a few minutes to revise your own knowledge of this with the diagrams below. We work this area all the time in our clients. It's probably the most common massage that we do, but it's still worth taking a few moments just to locate these muscles on yourself or on a friend, because that will help you with your revision. You can see from the detail of the diagram that if you're working with your head tilted forward down for long periods of time, you're putting stress onto your neck and shoulder muscles. This will affect both the superficial and the deep muscles, and it can give a whole host of problems from neck and shoulder pain and tension right through to tension headaches. Muscles don't work in isolation, of course. If you're holding your phone, you're driving, you're stretched out using the computer, you're extending your hand and arm muscles. So when we come to the treatment part of the course, we'll treat holistically, looking at all of the interactions between the muscles. One tight muscle doesn't just mean pain and tension in that muscle. It can have a ripple effect throughout the whole body. Tension headaches will respond very well to over-the-counter painkillers, but of course some people don't want to take those at all, and they're not good to be taken for a prolonged period of time. If we take too many, they can give us headaches. Rather than just taking painkillers, it's better to look at what are the triggers and see if we can start to address some of those in our lives. There are a lot of triggers for tension headaches. Stress and anxiety is one, squinting at papers or at a computer screen, poor posture, lack of sleep and tiredness, not drinking enough water or fluids resulting in dehydration, low blood sugar from missing meals, bright sunshine, not moving around enough, allowing muscles to tighten. Changes in the weather can have an impact. Having your hair tied up too tight can give a tension headache. Being exposed to too much noise or noise at a certain frequency, and even certain smells can be a trigger for some people. Now, avoiding all of these triggers is very difficult when we live and we work in a public space, but knowing the triggers can help manage and can help deal with the headaches much quicker when we do get them. Exercise, relaxation, hydration, these are all helpful in treating tension headaches, along with taking a break from the computer screen, ensuring that your blood sugar doesn't get too low, relaxing hair ties, wearing the correct glasses. There are also some very useful massage techniques that will help to alleviate a tension headache once it starts, and this is what we're going to look at soon. One of the side effects from massage, of course, is that it can also make your client look younger. It can relax the muscles that cause those frowns and wrinkles, so you help your client with their headaches and send them out you're looking younger. It's got to be a bonus. Before we move on to the practical work, let's look at a related issue, that's sinuses and sinus drainage. The sinuses are a connected system of hollow cavities in the skull. The cheekbones hold the maxillary sinuses. These are the largest at about 1 inch across. The frontal sinuses are located between the eyebrows. The ethmoid sinuses are between the eyes. In the bones behind the nose are the sphenoid sinuses. Sinuses are lined with soft pink tissue called mucosa, and all these usually contain is a thin layer of mucus. Most of the sinuses drain into the nose through a small channel or drainage pathway known as the middle meatus. The sinuses have a number of functions. They lighten the skull because the bone here is much less dense than elsewhere in the skull. They help our voices by improving its resonance, and they produce a mucus that moisturizes the inside of the nose, which helps protect the body from dust, from allergens, and from pollutants. The sinuses can, however, also cause problems. Common ones include blockages. Within each sinus is an ostium, which is an opening that's responsible for drainage. If this gets blocked, then mucus backs up and everything gets clogged up. Some people will have a deviated nasal septum. The nasal septum is a thin wall of bone and cartilage inside the nasal passages. Ideally, it's in the middle of the nose. Some people are born with it offside. Most people acquire it through a sports injury where they get hit on their nose and that knocks it off centre. This makes one side of the nose smaller than the other side, and the small side will tend to block up. Allergies or chemical sensitivities can give rise to sinus problems, and some people just are born with narrow sinuses. The world's best massage is not going to correct a deviated nasal septum or change the physical bone structure we were born with, but it can help to give some temporary relief from blocked sinuses. For some people, it will give much longer relief. The massage we're going to do for tension headaches also works most of the points that we need to work for sinus drainage massage, so you can follow all of the techniques given here. If you're just doing a sinus drainage treatment, you don't necessarily need to do the warm-up work and the shoulder work first. You can jump straight in at the face and the head work. What we're adding here is an additional gentle technique at the end of the tension headache massage after you've done everything else on the face and the head, which can assist with that sinus drainage. Just doing that one technique on its own isn't really enough, but it doesn't mean it has to be a long treatment. You can just do the head and the face treatment, adding in these sinus drainage points. One task before we move on to look at contraindications, please just take a few minutes to refresh your anatomy and physiology knowledge with a diagram of the sinuses in your course notes. And again, just take a minute to find these areas on yourself. As with all massage, we need to look at contraindications for treatment before we treat. If somebody is experiencing tension headaches, tension type headaches, more than 15 times a month for at least 3 months in a row, these are then defined as chronic tension headaches. Now, chronic tension headaches become more debilitating just because they're so frequent and so long-standing, and that can have quite a negative impact on life. If that's the case, if the client hasn't already been to see their doctor, it's worth them having a visit just to rule out any underlying cause. If headaches are accompanied by a very stiff neck, fever, nausea, vomiting, confusion, or come on follow an accident, especially involving a blow to the head, or if they're accompanied by weakness, numbness, slurred speech, or confusion, you need to call emergency help, emergency medical help for that client. Don't massage, just get them to the emergency room. If the headache is around one eye and is very intense, it's more likely to be a cluster headache, and treatment for that is different. It's important that medication is got quite quickly to prevent that becoming a recurrent problem. If someone's had a stroke or a transient ischemic attack, a TIA, in the last 3 months, then any massage to the neck has to be avoided. There's an increased and real risk of another stroke or TIA if you work the neck. So massage around the neck area is completely contraindicated in those situations. The client should get the doctor's consent even for the gentlest of head and face massage, but avoid all of that neck work. If you know that your client has atherosclerosis or hardening of the arteries, avoid the neck work as you want to avoid potentially causing a problem with those hardened arteries. If someone has a head or a neck injury, don't massage. If someone's just had dental work, particularly root canal work, or has dentures, then you need to avoid the jaw part of the treatment. If your client has a cold, sinusitis, or other active infection, you should wait until that infection has passed. You may make it worse, you may pass it on to other clients, or you may catch it yourself. So just wait until after their infection's cleared up. So before we move on to the practical demonstration, let's review the main points. First of all, tension headaches are common. Most people will experience them in some point. They're not normally a sign of something drastic going on in the body. Secondly, we need to look at what's causing the problem and try and avoid and deal with those triggers so that we can prevent them reoccurring. 3, there are some very effective massage techniques for tension headaches. These can be done safely and effectively. 4, there's some key contraindications. If someone's had a stroke or a TIA or has hardening of the arteries, we don't massage the neck. If someone has other symptoms, slurred speech, blurred vision, has had a head injury, or even has a cold, we don't massage. Again, read that full list of contraindications that are in your notes. Finally, if somebody has sinus issues, we can assist with that through this very simple addition onto the massage, the sinus drainage massage, just so long as they haven't got a current infection or just had surgery. If you have a longer treatment time, you'll get more effective results by working the whole of the upper body, starting with some very detailed handwork. If detailed handwork isn't something that is part of your existing modality, there is another short video course as part of this series where you can pick up those skills. Otherwise, use the techniques from your own modality. Sometimes, of course, you might only have a short treatment time, or you might be working in a corporate environment where somebody can't undress for a treatment. In that case, you're going to do a shorter treatment and you can focus mainly on the head and the face with a little bit of shoulder work and the back of the neck. The treatment here will focus specifically on the head and neck work, with that small amount of work on the shoulders as a specific treatment for tension headaches. If you can, incorporate that whole upper body treatment, but if you can't, you'll still get effective results just from doing this shorter treatment. Let's take a minute to look at client comfort. If you're working in a cold climate, then consider using a heated table or electric blanket underneath the client. This will help the muscles to relax and to help your client relax. Working with dimmed lighting will also help. You can also use these treatments as a kind of massage first aid for a friend or colleague. You can do them sitting at a desk. It's also one of the few massage techniques that you can do yourself. For the next techniques, you can do them in any order and you can keep repeating them many times as well. You'll find some techniques will work better for some clients than others. It depends on the source of their tension. So mix and match the techniques. As you work, try not to get stuck in a rut by always doing it the same way. If you've got longer with a client, you can repeat the techniques more times. If you've just got a short treatment, you can do them a couple of times and you will get that effective release. Now remember, with this work, ideally we've already done the work to the hands and the arms and the shoulders and the upper back, but we're assuming here that you've already done that work, so we're going to focus specifically on the work on the shoulders, the neck, the head and the face. Now again, if hand massage is not part of your normal modality, there is an extra training course on that which will give you all of that detail and allow you to do this deeper treatment. I'm going to demonstrate this shoulder warm-up in two ways, one with my client dressed and one where I can use oil direct to the skin. But it could be that you're doing this treatment in a corporate environment where the client can't undress, it's not appropriate to undress. You could do this with your client seated. It could be a colleague that you're helping, and then you're simply doing this work with them seated at their desk. So all I'm doing here, I'm running over kind of on the bra strap lines, really. I'm just using the heel of my hand and I'm just getting this tissue starting to move. I'm not going too deep to start with, so you can do it equally with your fingers. You can make small circles with your fingers all across the shoulder areas. Just make sure that you avoid the spine, and at the same time you could use your thumbs. Just be careful if you're using your thumbs to protect them, because they are the tools for our trade and we do need to make sure that we don't damage them. So where you can, use your fingers just as an alternative. You can roll with the palm of your hands. Now you won't get as much warm-up work working through claws, but it is important to do something just so that you start to address the tension in the shoulders, because the tension in the shoulders may well be the root cause of the tension headache, so we don't want to ignore them. You can either work both sides at the same time with either thumb's finger or your hand, or you can alternate. It doesn't really matter. What I'm picking up here is a little crunching of the muscle as I'm doing this deeper work, which is a good indication that we need to do some more work up here. So that's the demonstration of it clothed, of that part of the massage clothed, and now we'll show it unclothed where we can use the oil. So now my client has removed her top. It means I can use a little oil. I'm of course warming the oil in my hands, I'm not pouring it straight onto my client. Can smooth out across the shoulders. Nice small, slow movements. As you do that, as you apply a little more pressure, you'll feel the areas where that resistance is. For Margaret, it's just here. Again, you might be able to see that little jump on the film. So I'm warming the area up. I can come right out now. Across. So I'm starting at the back of the neck. I'm coming down. I'm slowing down because there's resistance there. You can see there I'm supporting my thumb with the other thumb. And I'm stopping before I get to the bone here. It would not be very nice if we massaged over the bone. So I'm doing a deep move with my left thumb and then I'm just smoothing out with my right. And you can see how with the oil we can get a little deeper. That would always be my first choice, but sometimes circumstances dictate that you can't work with oil. Often for tension headaches, you might find that you're doing this as a kind of massage first aid, just for a friend or a colleague who's having problems at the time. You can make a difference in just 5 or 10 minutes doing this work. But obviously, if you've got a client who's suffering and you've got them booked in for an hour, you can do this much more detailed work, which will give better results. See, I'm coming right up to the hairline. I've followed the line of the shoulders up the back of the neck. And my fingers at either side of the spine. Right at the base of the skull. And I'm just making small circles with my fingers. And that will start to release the neck muscles down into the shoulders. I've started in the centre. And then I'm moving out 2 or 3 circles with each one. And then I can smooth back down over the shoulders. Now you can spend 10-15 minutes doing this. If you've got the time, the more time you spend doing this, the better. And you can just keep repeating the same moves. You can follow up around the shoulder blade. And again, we're just always working out until we get to the bone, stopping short of working over the bone. Back to the little circles. Moving out away from the spine. And back down across the top of the shoulders. The orbicularis oculi muscles are located in the eyelids. The sphincter muscles are arranged in concentric bands around the upper and lower eyelids. Their main purpose is to close the eyelids, but they also assist in the drainage of tears from the eyes. These muscles are located just underneath the skin of the eyelid, so if you are massaging around this area, you're using super light touch. Be careful always to avoid touching the eye itself and never to drag the skin. The muscle attaches medial to the methocanthal region and laterally to the lateral canthal region. The link to headaches here tends to be around eye strain. Straining the eyes can lead to an increase in the muscle load, so if you're touching this area and it's particularly tender, it will be worth referring your client to their optician just to check their eyesight, which is not a bad thing to do anyway for someone presenting with tension headaches. We then move to work with the client face up. This is how we're going to do the majority of this massage. Having done that warm-up work or just that shoulder release, it can be nice to relax the eyes. Now you can do that if you just rub your fingers together and place your hands across the eyes. You add a little bit of warmth. It's important not to press on the eyeball at all. It's just very gentle. I'm cupping my fingers over the eyes. If you hold that for a minute or two and then take your hands away, that just helps the client to switch off a bit more. You can also get things like this, like a heated eye mask that you can plug into a USB, and that adds some more heat in, and that can help your client to relax as well. But your hands will do just as well. All of the time that you're doing this, you're encouraging your client just to relax and to breathe deeply but naturally. The corrugator supercilii muscle is a small, narrow facial muscle located at the medial end of the eyebrow. It lies between the frontalis and orbicularis oculi muscles. Its origin is in the medial part of the superciliary arch, and it inverts via penetration of the frontalis and orbiculus oculi muscles and into the skin over the middle of the eyebrows. When we're working this muscle, we can apply a little more but still fingertip pressure, and we always start medially and work outwards. Again, always being careful not to drag the skin. You can make small circles along the line of the eyebrow. You can pick the eyebrow up between your fingers and roll it, and you can use the press and release techniques. So much tension can be held in these muscles. They're important ones to work and not to overlook. The area is typically tight and a problem in someone who's stressed or tense. It can be easy to diagnose as they're likely to be frowning as they talk to you. We then move on to work on the eyebrows. Now, it's very important that your nails are short for this and that you don't roll your fingers across onto the eyes. So you're purely working on the eyebrow and you'll feel that bony ridge that you're working on. Start with your fingers right in the middle. You can just apply pressure with your thumb, or if you use your little fingers or your fingers, you make very small circles and you're coming right out along the edge of the eyebrow. Now, if somebody has very high eyebrows, very thin eyebrows, because they've plucked them a lot or had them waxed a lot, what you're really feeling for is the top edge of the eye socket, and that's the line you're following. So the eyebrows are a guide when they're natural eyebrows, but if they've been manicured a lot, you may just need to feel for the top of the eye socket. I'm using my thumb here just so that my hands are out of the way so that you can see what I'm doing. You can see I'm doing it in very, very small circles. You can also just press and hold. So I'm starting in the centre and then I'm moving out. If somebody has been frowning a lot, this will be a very tender spot. Some people will find this, they'll almost be wincing as you do this work. Other people won't be affected by it at all. You can also do it while you hold your finger in the middle and just press and release out along the eyebrow. By holding the finger in the middle, you're stopping the skin being dragged across. Now, if you're working with somebody who has very dry skin or somebody who's particularly elderly, you might want to use a little cream or lotion here just to stop dragging the skin. So if you're doing the finger in the middle, you're doing one side at a time. If you're using your thumb or your finger on both at once, then you come out equally on both sides. So you can do that static pressure, or you can do the little circles. You can do this 4 or 5 times in one go, or you can do it once and come back to it. It really doesn't matter. If you find that your client is particularly tight in this area, then it's worth doing more than once. If not, it's something that you can come back to. We can do most of these techniques in any order and as many times as we want. The one thing we don't keep doing is the deep jaw release that we'll come on to soon. Now we're coming to work across the top of the forehead. I'm just going to use a little bit of lotion so that we don't pull the skin. Just spread that out, we don't need much. Now there's 2 ways that you can work this. You can use your thumb or your finger flat in this position or in that position, or you can use all of your fingers curled up with the little finger towards the eyebrow and the index finger out towards the hairline. I just find it more comfortable to use my thumb, but use whichever is easier for you. And all we're really doing here is smoothing out across the forehead. We're stopping just in front of the ears. We're not applying a huge amount of pressure. It's nice to do a few straight movements first. And then you can do it while you're pressing and releasing, pressing and releasing, pressing and releasing, and moving all the way out with this press and this release. You're not putting a lot of pressure on, you're really just starting to move the skin. It's quite a surface movement. And it should be one that's very relaxing for your client. We're not putting a lot of pressure on, particularly over the temples. Come down to what is probably my favourite part of the massage to receive, which is the scalp massage. There's 2 different techniques that we're going to use for that. The first one are these circles. Now your fingers are just slightly apart. I'm using all 3 fingers. I'm doing both sides at once, the 3 middle fingers. I'm pressing down and I'm making sure that I move the skin. It's not like being at the hairdressers where you're moving the hair. You're actually pressing enough so that you move the skin underneath. The skin should be fairly free-flowing across the scalp. You will find that, particularly for people who grit or grind their teeth, that sometimes it feels quite locked, that this area can get very tight. So we're looking for that nice movement. As you can see here, we've got a lovely movement of skin over scalp. You can do this for as long as you want. Your client will not complain about this. If you have a client who's completely bald, you might find that their head will become quite oily, just because the skin still produces the oil that your hair normally needs. So just have a towel handy that if needs be, you can just wipe that excess oil off, and then you wouldn't need any lotion as well. You can use the client's natural, what would be hair oil. Come as far back as you can get with this movement. Again, just making these little circles. We're coming all around the head. So you're covering all areas. With this, it doesn't matter how many times you go over the areas. Having done the circles, we then move to the second scalp technique, and we're using our thumbs for this. You're finding the midline, which if you just come up from the nose, straight up to the centre of the scalp. And this is a press and release action. So I'm pressing, holding and releasing. So it's press, hold, release. Press, hold, release. Now, it's not a really firm movement, but nor is it a really soft movement. Because this in particular is going to pick up on any jaw tension and help to release that. It's quite an important move to do. You go all the way back as far as you can reach until where your client's head rests on the table. Then you can just come back and repeat the same thing. And come down this centre line 2 or 3 times. Each time that you do this, you can repeat this move many times within one massage, but just each time you do it 2 or 3 times. And it's nice after that to go back to the circles again. So whereas when you're at the hairdressers, you can hear the hair move. Your client shouldn't really hear that because it's the whole scalp that's moving. We can also very gently pull the hair. You can see I'm pulling both sides at the same time. I'm not twisting the hair at all as I'm going. I'm placing the hair between my fingers and I'm pulling at 90 degrees outwards from the scalp. This isn't the same as having your hair pulled in the playground. This should be quite a nice feeling. A lot of people describe it as it's allowing their scalp to breathe. As you just very gently pull on the hair and you move the scalp across the head. It's not big movements. It's not a big tug. It's nice and gentle. Gentle but assured. And if you're not sure on how this is for your client and how much pressure you should be applying, just ask. It should feel good for your client. It shouldn't feel ouchy at all, but it should feel effective. And again, you can repeat that for as long as you like and as long as your client likes. And then we're going to move on to the jaw. We're going to start right in the centre of the chin. All we're doing is following that jawline. We're following the bone. What I'm not doing is going underneath. You've got a lot of glands underneath and it will just feel very uncomfortable for your client. And if you get anywhere near the throat, the client will feel very protective of that area. So be careful with your fingers. You can see my spare fingers are just up in the air. They're not round here hanging on. Again, you can press or you can make small circles. Working from the centre outwards. Most clients will find this fairly relaxing, but again, if you have a client who grits or grinds their teeth, this might be challenging. So take your cue as to how deep you should go from your client. But remember, the face is a delicate area. We should never be working too deep in the face. We don't want to cause any problems. We don't want to send anybody out with a bruise. So we're working quite gently around. We're working all the way right from the centre, following the jawline up until really you get to that jaw joint. If you're not sure where the jaw joint is, just ask your client to gently open and close their mouth and you will feel that movement. So you'll feel that joint of the jaw and you're stopping, thank you, you're stopping just in front of that jaw joint. Having found where that jaw joint is, we're going to do the deeper work here. This is perhaps the area that will cause the most discomfort to your client. It can be a challenging spot to work, particularly if they do grit or grind their teeth or if they've been frowning a lot and have a lot of tension. I'm going to ask Margaret just once or twice to close her mouth again. And I can feel the boniness of the jaw joint there and I'm coming just in front of it. I'm not into the cheek. I'm still firmly around the jaw joint. Having found it with my fingers, I'm going to swap to my thumb because I need to get some good pressure in here. Now, I always warn my clients that this could be challenging, that I'm going to hold the pressure for no more than 3, and you'll find that the count of 3 will be enough to release it. I'm going to ask my client to just slacken her jaw a bit so her mouth is just open very slightly. I'm then going to ask her to take a nice deep breath, and on that breath, I'm going to press into that joint. I'm going to count to 3 so that the client knows where I'm up to. At the end of that 3, I'm going to remove my fingers quite slowly so that it's not a jerky movement at all. So when you're ready, Margaret, if you'd like to take a nice deep breath, just allow your jaw to fall open. 1, 2, 3, and release. It is a little bit of a mean move, but it's a mean move with a really good purpose, and it is really effective. You can do some gentle circling afterwards, up in front of the ear. It may smart a little bit, but it will only last 2 or 3 seconds after the release, and then that will go. But your client will often report that they feel that their jaw is a lot looser and that they've got more freedom in that area. The platysma is a thin, sheet-like muscle that lies superficially at the front or anterior aspect of the neck, although it does also extend to the posterior. It arises in the upper thoracic and shoulder regions from a fascia that covers the pectoral major and deltoid muscles. Its thin muscle fibres cross over the clavicle and proceed obliquely superiorly, laterally and medially over the neck. The platysma muscle fibres thin out anteriorly and attach just behind the symphysis menthae. On the lateral side, the muscle fibres pass over the mandible and some fibres insert into the bone, while others merge into the subcutaneous tissues. Because this muscle is situated within the subcutaneous tissue of the neck, again our touch is light. Apart from very light stroking over the front of the neck as though you're applying a lotion, the only significant way we access the muscle is where it meets the jawbone, where we can work in the smaller circular movements we've shown in the treatment, working purely on the top of the chin, not on the glandular area below it. Problems in this area are often caused by prolonged periods of deep concentration or stress. This tension might be exacerbated by poor tissue mobility around the pectoral major and the anterior deltoid, as well as postural deviations like forward head posture or kyphosis. Well, we can do the head work in any order. Really, we leave this neck work till the end until we've relaxed everything down. Now, we're only working on the back and the very side of the neck. We're not coming down and forward and into the throat. Your client will guard against that, and you will undo any good that you're doing. We can work at the back of the neck. We're following just down the side of the spine and then out across the shoulders. If your client doesn't have any neck problems, you can ask them just to turn their head slightly, and that will help you gain access into the side of the neck here. I'm not applying a huge amount of pressure. Again, I'm being very careful. I'm not coming forward of this center line. You will pick up at the top of the shoulders once you get behind that center line any other tension that's coming into the shoulders. You can use the flat of your knuckles, you can use your thumb. We'll turn the client on the other side. If it's a new client, so they're not familiar with your work, it might be easier to ask them to turn their head. It's a lot of trust you place in somebody when you allow them to move your head. So just asking the client to move it might help them stay more relaxed. We'll come back to center. We can come out across the shoulders again. We can come up, right up into the hairline again, into the base of the skull. And those circles that we started with, we're now repeating. A little bit deeper because we've released everything else around it. And we're going to move to the sinus drainage points. Now this is really simple in itself, but remember we need to have done the rest of this head and face work first to make it most effective. I'm just going to put a little bit of lotion on Margaret's cheeks ready because I'm going to finish these moves by stroking out across the cheeks. We don't have to do this treatment if somebody hasn't got sinus problems, but it won't do any harm to do, and it can feel like a complete treatment. So remember, if you're doing this for sinuses, you need to do all of the other head and face work first. All we're doing is using your little finger, being careful that your nails are really short because you're working very close to the eyes, is we're going just underneath the inside of the eyebrows. All I'm doing is pressing and pulling up slightly into the eyebrows. Same little fingers then are going either side of the bridge of the nose, right on the inside corner of the eyes, and then down halfway out across the bridge of the nose. So it's right underneath the bottom of the eyebrows on the inside, right in the centre, and then right across the bridge of the nose. You'll see in your diagrams in your notes that these are the sinus areas that we're working directly on, and just applying that pressure helps with that drainage. We're then going to drain everything out. So we're using the little fingers. You can see I'm hooking my fingers underneath the cheekbones, and we're moving out towards the ears. There is a little bit of pressure being applied here, but it's not too much, because again, you're working on the face and its delicate structures, and you just need to keep repeating that. You repeat it 4, 5, 6 times. You can hold for 10 seconds, 20 seconds, 30 seconds. You can mix and match how much you hold for. But remember, it's gentle pressure, which is why I'm using my little fingers. Being careful to avoid the eyes. Stroking out then across the cheeks. So we've gone under the cheeks and we're going across the cheeks. And just keep repeating that. Do a few repeats of it so that you know you've worked all of those areas fully. Aim to finish your treatment by coming back to the eyebrows. You can just do that stroke across. You can also repeat any of the scalp work. It is nice to finish by just gentle strokes from the bridge of the nose upwards. Big relaxation area. This will also help children go to sleep at night if you have children who are struggling to sleep. Some people like to finish then by placing the hands back over the eyes, or you can just put gentle pressure on the third eye point. All depends on your modality, your approach to your massage. It's nice to signal to your client when the treatment is finished. I tend to do this just by placing my hands on the shoulder. I'll encourage the client to rest before they then get up and have a drink of water. Now, these are all techniques that you can administer as a first aid thing in the workplace and that you can self-administer. These massage techniques are good for prevention between headaches or for a fuller treatment during a headache. As long as the headache isn't accompanied by other symptoms, it can be carried out while the client has a headache to give that immediate relief. So to summarise this practical work, remember, you can do all of the main head massage in any order. You can repeat any of it as many times as you want. The only one not to keep repeating is the very deep jaw release. That's something that most clients will only want once. Let's summarise the techniques. We warm up the neck and the shoulders. We relax the eyes. We have the eyebrow release, the forehead release, the stroking out across the forehead. We have the scalp massage moving in circles, the scalp massage going down the centre line. We have the gentle hair pulling. We have the jawline work and then that deep jaw release. We have neck work at the back and the sides, sinus drainage and out across the cheeks, returning back to the gentle head work. Thank you for joining me in this exploration of dealing with tension headaches and sinus drainage. Head massage is one of the most relaxing massages to both give and to receive.